Welcome to Samba Samba. Enjoy the video.
You start by restoring fluids and reducing gut workload. Mix 1 liter water with 6 teaspoons sugar and 1/2 teaspoons salt to make a simple oral rehydration solution and sip slowly every 5 to 10 minutes. While you hydrate, stop dairy, caffeine, and alcohol because they irritate the gut. Choose bland brat foods, bananas, rice, applesauce, toast, to supply binding starches and potassium. Once done, make sure you avoid fatty or spicy meals for at least 12 to 24 hours to let the bowel calm. You now focus on reducing stool frequency and restoring intestinal balance. If you have no fever or bloody stool, consider a short course of loperamide per package directions to slow transit. This helps the gut reabsorb fluids. To rebuild healthy bacteria, take a probiotic containing 1 to 10 billion CFU daily or eat plain yogurt with live cultures, because microbes shorten recovery. Add soluble fiber like 1 to 2 tablespoons of psyllium or cooked oats to gently bulk stools, and space medications so you can monitor improvement. You finish by restoring normal intake and watching for red flags. Gradually reintroduce regular foods over the next 48 to 72 hours, adding lean proteins and cooked vegetables stepwise so the gut adapts. Monitor for dehydration, high fever, severe abdominal pain, or bloody stools. These require prompt medical attention because they suggest infection or complications. If diarrhea lasts beyond 2 days despite remedies, see a provider and bring a list of recent medications and, if possible, a stool sample to.
Thanks for watching. Consider subscribing if we helped you.